Could you tell us about your experiences of health and care services over the past few months?
The message from the government has been the NHS is open for business and will continue. My experience, I'm afraid, doesn't suggest that to be the case. I had a period of 4 months where I was unable to speak to my GP. They disabled the appointment making facility online, changed their phone system. The receptionists were not fielding calls, etc., etc. So I felt very much alone. Only in the very recent past, i.e. week, 10 days, have I been able to see one of my GPs and discuss a change in medication. If you can't speak to the people you're supposed to speak to, patients are forced to take things into their own hands. And that forms a barrier. Now, I still feel slightly resentful towards my GP as a result of this, although they have shown signs of wanting to address it now.
Are there any other health services you've had contact with?
I've had contact with obviously the diabetes team to try and get. I mean, I'm now 18 months overdue for my eye screening. Well, I know there's issues with the eye screening and diabetes anyway. I would say, and I'm a huge fan of the Late Leeds programme, I would say it's been a bit lacking. Because they haven't had the personnel to deliver it or any way of delivering it. I know they're working very hard to do an online offering of the Leeds programme now, etc. And that's really, really important, and I applaud that immensely. But maybe what we should learn from COVID is all these sectors, whether it's diabetes or whatever the specific discipline is, maybe there needs to be an online offering for people to access and say, hey, help, I'm struggling. Even if it's just a cheery voice to say, yeah, I know where you are, I've done that myself, then it was not going to make people feel quite so removed and isolated. So because of my hospital admission was largely around diabetes in July, I felt that I should have my HbA1c checked again now, sort of thing. But I'd informally spoken to the Leeds programme, and they'd said, well, normally it might be 6 months, but bearing in mind your history, you might want to try and get it done. So I went to the GP.
You wanted to tell us a bit about your experience of medication reviews.
I have a plethora of meds. Now, it appears that if you go to the doctor and you say, oh, I've got blood pressure, they say, oh, I'll take some of these. And oh, I've got diabetes, I'll take some of these. And they're all about adding them up. And every year they have what they call a medication review, which appears to be you're still alive, they must be okay. But I just wish somebody would look and say, as indeed they have last week, driven by me when I said, look, I don't believe this particular med is working for me. And she said, well, we'll change it then. And so we changed it, and miraculously, the last 5-6 days, I felt hugely better.
And what would have made this service better?
With a 5-minute consultation to the patient, do you believe there's any issues? Right, okay, you don't. Let's have a look at how your medications changed from this year to last year. Let's tap those into this algorithm and see if there's anything thrown up that says these drugs fight against each other. And as I say, with mine, there's 3 drugs that listed as being or having hypotension as a side effect if used with one of these others. I think that would have stopped me having at least 4 or 5 visits to the doctor over the last 3 years.
If you could change one thing to make your experience better, what would it be?
The one issue that seems to be a constant thread throughout all my negative experiences with the NHS is that little old word communication. And somebody telling me what has happened, what's going to happen, and what we need to do to make sure what has happened doesn't happen